Uh, on the 19th of March, flanked by the COVID-19 multi-agency co-chair, Madam Susan Bovero, the county commissioner, we addressed you about a COVID-19 suspected case, which thankfully, after tests, proved negative. Fortunately, ladies and gentlemen, we have been always getting our cases proved negative within the county. But cases which come from outside, because Cambridge CDC is centered in Kisumu, both at Kisian and Jaramogi Oginga Odinga Teaching and Referral Hospital, and Jaramogi is also a testing center. We have cases coming Homa Bay, Migori, Vihiga, and Siaya. Most of these cases are the positive ones recorded at the test centers. Today, 68 days since the MOH announcement of patient number 1 with the county recording, the whole county recording 1,109 cases and 50 deaths from 52,500 tests. Here in Kisumu, we are still at 0 cases, having carried out 307 tests. These tests were carried out from suspected cases that exhibited case definitions and admitted at our isolation centers, from persons who had come into contact with suspected or corona-infected persons, traced and admitted to the quarantine centers, people with respiratory illnesses whom we have started testing as a precautionary measure, truck drivers, hoteliers, and people who are being tested at their own requests. Of the 307 tested, 41 are from isolation wards, 102 from quarantine centers, 36 JTRH patients with respiratory illnesses, 11 inmates from Kodiaga, 27 truck drivers, 82 hoteliers, and 8 on requests. The oldest among these was 74 years, while the youngest one is 1.5 years old. Since the first case was reported in the country, 26 counties have since recorded positive cases, contributing to the cumulative total of 1,109. Across the region, 5 counties have reported positive cases, raising concerns and fears among the people of Kisumu, and even nationally, considering the positioning of Kisumu as a trading and transport hub. Let me add that the latest emergence of cross-border crossing on the Migori-Tanzanian border is worrying, because I'm glad that Migori people stopped them there and tested them before they come to Kisumu, but there are panya routes people may follow. So that's why I was saying that if things rested as the scenario was, we expected very slow rise in our curve. But with Tanzania posing this threat, now we must think twice. Ladies and gentlemen, the spread of infections across the globe has been scientifically calculated using different mathematical models based on epidemiological landscape prevailing in different countries. Using those models and aware of occurrences around the world, especially for countries that focused on clinical management, we realized early that our best bet must be on response and prevention. So regarding response and prevention, this is what we have done. First, the issue of training of health workers. At the outset of the outbreak, and with support of the national government, we sent a team of healthcare workers for training on the different aspects of COVID-19 management by officers from the national government and World Health Organization. This team formed our core team of training of trainers and have since trained and sensitized a total of 2,187 healthcare workers. The trained and sensitized healthcare workers is given in a table that I will hand over to you. But in essence, you'll find that we have community health workers distribution per county who have been trained to deal with public awareness, prevention measures at the village level. Let me just give you the figures. In Kisumu Central, we have 219 community health workers. In Kisumu East, 145. Kisumu West, 150. Nyando, 188. Moroni, 256. Nyakach, 215. Seme, 120. A total of 1,373. You realize that the figures vary according to the size of the sub-county and the number of wards that are in those sub-counties. But these CHWs are also supported by RCOs 121, nurses 309, pharmaceutical technologies 47, lab technologies 67, public health officers 68, community health extension workers 49, and others 153. Community health workers 1,373, which I have mentioned, and that's a total of 2,187. Professional health workers working in the country, specifically on COVID. They've been trained to respond to COVID. The next thing that is important in this prevention and awareness initiative is risk communication, public awareness, and education. Public education has been key in creating awareness and enhancing adherence to the set prevention protocols. Various communication strategies were implemented to reach various audiences. The Risk Communication Department of the Department of Health and Sanitation, in collaboration with the County Communication, has conducted 21 radio talk shows and interviews through the local FM stations with a cumulative reach of 1.2 million residents of Kisumu have been conducted with the governor. The governor having done 6 TV interviews with a possible reach to 250,000 people, conducted 25 road shows, and distributed 15,000 IC materials. In partnership with Farm Access Kenya, through their MTIBA platform, a key tool that was used at the registration of USC households, we have blasted out 249,618 announcements, which accounts for 83% of the targeted 300,755 households through this particular medium. The multi-agency committee, co-chaired by myself and the county commissioner, has also conducted 7 press conferences to brief and disseminate guidelines as set by the Ministry of Health at the national level and the World Health Organization. Now, that data is also here. I don't want to read it because it will bore you unless you're seeing it, but you'll get it. The risk communication and public health outreach culminated in the setting up of Kisumu County COVID-19 Response Call Center in collaboration with the Maseno University and Farm Access, which we opened on the 6th of May, 2020, at a function that I presided over, and you were there. The 24-hour call center, manned by 18 medical students from Maseno University, has played a key role in the surveillance chain. The county COVID-19 Rapid Response Call Center receives community alerts which help in response and incident reporting, e.g. travel, COVID-like symptoms, reporting contact, other sickness persons, women and children, floods, rumors, myths, and misconceptions, and people in need of prevention, test, treatment, response status, travel, quarantine, isolation, etc. In fact, it is this call center which has made it possible quite often for us to know that in village so-and-so, somebody arrived from Nairobi, whom the villagers suspect may be COVID positive, and we should take action. And quite often, the health officers have responded very quickly. As of May 21st this year, 16 days since the launch, the call center has processed a total of 4,269 calls from an average of 267 calls per day. This is perhaps the highest nationally. The center, being the second call center nationally and the first among the 47 counties, has become so useful that calls have been received from as far as Mombasa, Nairobi, and Marsabit. Of the calls received, 120 have required and received the merited interventions. Again, you will see the distribution of the calls when you per sub-county, when you get a copy of this speech. Now, of course, we have continued hand washing and hygienic measures, and I'm glad to say that there's been 90% compliance in the county to this. I'm really pleased that everywhere I go, it doesn't matter how small a center it is, that the hand washing tanks and detergents and so on are available, and people have adopted the service very quickly. Surveillance and screening has been held particularly by a collaboration between our own county administration system and the provincial administration of yesterday. I think there's a very good harmonious working relationship between these two arms of government, and there are sub-county committees reporting to the county rapid response team and the Department of Health, and the reports reach us timelessly. I was worried that these reports do not come regularly, but I'm assured, I've been reassured by the Director of Medical Services, Dr. Fred Oluoch, that these reports are very regular and that we are getting them from all the sub-counties. We have distributed about 250 thermograms to screen people on the county borders, and this is very important. In fact, we are thinking of having a very serious screening station just before you reach the junction to Ahero to screen everybody that comes from Nairobi, following the incident that occurred in Siaya the other day, that 11 people who came with a body which had passed on because of COVID-19, Governor Achanga rounded them up, brought them here for testing. Out of those 11 persons, 7 were positive? 7 were positive. That's a very high percentage. And therefore it worries us, and we must take much more drastic measures in now screening our borders, particularly people coming from Nairobi. So I hope that action has been taken or should be taken very soon. In the past 2 months, we have been able to screen 664,856 people at the borders and other public places. The screening initiative is also supported by private businesses who have procured thermograms on the instruction of the County Department of Health and sanitation for us at their installation. Now, we have figures here on the screening data per sub-county, and it shows quite a high number of people screened per sub-county, with Nyakach recording the highest levels, followed by Nyando, then Kisumu, then Seme, then Kisumu West, then Muhoroni, and then Kisumu Central, and Kisumu East, the least. Not surprisingly, because Kisumu East is a very small sub-county. But it shows that there are high level of screening from our sub-counties, and I think that gives us comfort that nobody is going unscreened who should be screened. Clinical and case management. Based on the epidemiological modeling scenarios, the county government set a clinical management plan. This plan envisages case management from the health centers to the referral facilities and taking cognizance of the critical element of healthcare workers. So we have holding isolation centers at Ahero sub-county hospitals, Moroni sub-county hospitals, Nyaka sub-county hospitals, Gita sub-county, Chulaimbo, and Kombewa. As I said, these are holding isolation centers. In the event that somebody is highly suspected or has been diagnosed with coronavirus and is showing symptoms of sickness, then they must be held at these isolation centers, not just for testing, but for treatment as well. We have quarantine facilities at 148-bed quarantine centers at 3 Kenya Medical Training Colleges. Kisumu has 128, Lake Victoria has 12, and Kombewa has 8. Sunset Hotel, where we are, has been acquired for use as a quarantine operation center for healthcare workers who will, on a day-to-day basis, be here because of interaction of COVID-19 patients. They have not yet started using it because, as I said, we are waiting for that curve. We are watching it very carefully. Isolation wards, as I said earlier, and I don't need to repeat, that we have a very effective isolation ward, Jaramogi Oginga Odinga Hospital, with telemedicine equipment to enhance speed and frequency of management while also taking precautionary care of healthcare workers of advanced age. Kisumu County Referral Hospital has 4 beds and is being expanded to 120 beds through completion, upgrade, and equipping of the new maternity ward. As Chief Officer will tell you, I hope that job is complete. That's true, yeah, sure. The job has been completed, so we know that the Kisumu County Referral Facility will have 120 beds in the event that we need them. Our forewarned is a foreprepared, as I've already said. Further, Lumumba Hospital has also been earmarked for upgrade to a 70-bed isolation center. So far, 30 beds have been received from a partner, and the county government is in the process of procuring the remaining 40. The government has also reserved the 25-bed Victoria Annex for use as an isolation center for healthcare workers in case of infections. Now, you may ask, why haven't we acquired these 70 beds, and these 40 beds that need to be added? It's a budgetary issue. Our supplementary budget has just been passed by the Assembly, because if we're going to spend money, you have to get it through the Assembly. So now that it has, then we can be able to buy these beds and make sure that Lumumba is ready for any eventuality. Now, what is more important, and this is my last point, is personal protection equipment. This is an issue that is raised by every county, and it's one of the most thorny issues, because this personal protection equipment is not that cheap. And we were promised by the national government that the COVID fund, which we could use for buying them, but again, the process of approving expenditures, even when you have the money by the legislative process, takes time. And I do understand why the national government has not disbursed this money, because they have to take it through parliamentary process. The minister yesterday assured us that this process should be over soon and should get the money. Nonetheless, we have gone ahead as a county and acquired certain critical PPEs just in case. The government, my government, has invested 72,321,010 million shillings for the acquisition of the PPEs besides other commitments. Our PPEs acquisition plan is informed by the existing modeling and will be appropriately reviewed in line with the prevailing conditions. A further 19,485,000 shillings has been spent on surveillance activities, giving a total of 91,806 and 10 million shillings. Now, these PPEs are not cheap things, especially when you're talking about that overall thing that doctors wear. And in the event that you have higher figures of COVID-19 happening in the sub-counties, all the health workers will have to wear it. And it is disposable. So you spend a lot of money buying something, as soon as you use it, you dispose of it. But nonetheless, we have acquired them and got ready for any eventuality. If we don't use them, there's usually a market to sell them, or retain them in case you have another pandemic. The figures are here and you shall see them. I don't want to go to them. Now, in conclusion, ladies and gentlemen, we must always keep our eyes on the ball. With all that is happening around us, we cannot afford to go to sleep. That's common wisdom. You don't sleep when you face danger. When a lion is coming, you don't sleep. Or even you're doing something better than that you used to be doing, you get off and run away. Anyway, it's a time that we have to ramp up our risk of communication and sensitization and social distancing, use of masks and hand washing. And I'm grateful that you gentlemen and ladies, you're really observing it, except that gentleman over there. I don't know what he knows about the social distancing. Yeah, thank you very much, sir. Alongside the scale-up of risk communication, we intend to keep a close eye on enforcement of the prevention guidelines. I'm concerned that our zero status has planted some seeds of complacency among our people. We should not be complacent, ladies and gentlemen. That zero status, I will tell you, we want to test it. We have therefore decided as a government that we are going to do what I call a survey, a simple survey by random sampling stratified random sampling, social survey. Social science tells us that if you are doing a survey concerning human behavior, and of course health-seeking habits is human behavior, whether you have 40 million or 50 million or 100 million, you take a sample 1,500 and stratify it according to your population. For example, here, you'll have to find a higher number of people with preconditions, which are likely to get COVID-19 much more easily. A higher number to old people, because they are very vulnerable. Another higher number to health workers, because they are also very vulnerable. And then smaller numbers to the youth, who, because of their high level of resistance or immunity. For example, this young man has higher immunity than me. I mean, my immunity has been worn down of ages of living. So those types, you don't need to sample too many of them. That is what is called stratified random sampling. And if you take a random sample of 1,500 people, you are likely to get a much more accurate result about the population you are studying than if you do something called mass sampling, which to me doesn't really tell you much except the population that you are examining. So if you're going to a population as big as Kisumu, it's much more scientific to do stratified random sampling that we have discovered. And this is not something that I've just thought about today. It's a scientifically proven way of finding out what is happening in a population like ours. Finally, ladies and gentlemen, you know our Muslim brothers have Eid al-Fitr today, and Monday is a holiday because of Eid al-Fitr. I'm taking this opportunity to wish them, our Muslim brothers and sisters, a very happy Eid al-Fitr. May the good Lord give them the faith and the strength to fight against COVID as they have done, and may Allah grant all of them and all of us happiness as we face this pandemic. Asanteni sana, Mungu awabariki.